All right, are they playing good? Excellent. Hey. They're playing today? Wonderful. Good to see you, my friend.
No. Wow. Yeah, you sit and then I can park.
Yeah, we couldn't squeeze enough people in here if we had tables, so
Yeah.
you'll have to thank Lynn for the
Oh,
company.
no, that's all right. For Bill.
Are we playing?
Yeah.
Okay.
I'm loving this sunshine.
We gotta go. Now that it's a little bit.
2 more minutes? Okay.
I can like stand to the side here later for the center.
I've been looking at years ago. I snow up so the kids can slide down in the 70s, late 70s, 80s. Yeah, I like that it hasn't been nearly as bad.
Thank you.
That's fine. You know what they say, that you have to hear it 3 times before you repeat it. So that's great. I'm going to be
Oh, okay. I'm over, right? This is, I'm gonna reserve this one. Might as well figure it out. Sure, I appreciate it.
We appreciate you.
All right, I think we are about at the 9:15 hour. And so we want to continue with our elder care education series. And certainly welcome everybody again for this Sunday morning. And we've got a wonderful speaker who is here as our guest, who is Hilary Kerr. And she is an advanced care specialist with Bronson Hospital. She's going to be talking with us about advanced care and end-of-life issues. And so is our dear pastor, Rachel, who is going to be talking about those kind of issues, particularly as related to funerals and end-of-life issues regarding funerals and funeral planning. Also, on your seat, you will see a little survey. If you would fill that out for us and return it to Lynn at the end, that would be just super, because that'll give us some more information as a care team as to what we need to do further in the future around this issue or other issues that maybe you'd like to know more about, okay, for this faith-focused hour here. Without further ado, I'm going to hand it over to Pastor, but first, I'm going to say how timely. Yesterday in the New York Times, here's this great article about the ruinous cost of elder care in America. I don't know how many of you have seen it, but the stories in here are just so enlightening about what really is happening with seniors and caregivers and the struggles that people have to keep their loved ones in care, especially care for people who do not have resources, which is getting more and more critical. And, you know, the government, of course, enacted the Medicare and Medicaid Act in 1965, and our federal government has done very little to continue to support it and enlarge it and enrich it. So it's really an issue in elder care, and as we go forward, I think one of the issues for me is always advocacy. And we need to do more and see what we can do, not only to help each other, but to help this whole country with this issue. Okay, Pastor.
Thank you, Yvonne.
Uh-huh.
Just want to take a moment to say thank you to Yvonne and to Lynn for all of their hard work getting us together. For getting speakers,
Lynn.
And Lynn brought cupcakes.
Yay, Lynn.
So, thank you for that. She doesn't want to take them home. So, okay. So, briefly, before we get to our guests, thank you for being here, Hilary. I wanted to speak a little bit about planning the actual funeral worship service and some resources that we have here at Prince of Peace to help either pre-planning or when the person you love has died and it's time to plan the event that's coming. So There is a book. I believe there's normally a copy in our library, but I couldn't find it, so it's probably checked out. But I have 2 in my office as well. This is called Remembering God's Promises. It's a little handbook from the ELCA. It references our worship materials specifically, so you can look through and find hymns with the actual hymn numbers that we have, or just to look at why we do what we do in a funeral. Luther talks about funerals as having 2 purposes. One is to comfort those who are mourning, and the other is to commend our beloved one into God's care. So that is what we try to do through the liturgy of a funeral, where it's comfort for those who are mourning and grieving, and it's commending the person who has died into God's care. We often hear a lot of different euphemisms around a funeral. It's a celebration of life, it's a this, it's a that. There's nothing wrong with those, but I want you to know that, like, when you think of funeral, it doesn't always, like the traditional funeral, doesn't have to mean this very sad, somber, black-clad event. It's supposed to bring comfort to those who mourn. And so, some of the tools that we have to help plan a service that will bring comfort to those specific mourners for that specific funeral after a specific death. This is our sort of planning worksheet. You can fill a lot of this out in advance. You can sit down with me, or more importantly, sit down with your loved ones to think about what are readings that would bring them comfort at your death. What are songs and hymns that would bring them comfort at your death, or that want them to remember when they are grieving you. It can also give us some information, like which funeral home do you plan to work with if you've pre-planned some of that. Which family member is going to be our main point of contact for things.
Handouts are up here.
Yep, these are all up here because there's quite a stack of them today. You can tell us if you'd like to have a lunch here, or on the back you can include things like, would you like your obituary and your picture included in the bulletin? Is there a particular image you'd want on the cover of the bulletin? These sorts of details. It can feel uncomfortable to talk about before the fact, but I have worked with a lot of families who've never sat down to talk about what does my loved one want at their funeral, and they just come to me in shock. They're shocked and grieving in those first few days after a death, and you may have said, oh yes, I love that hymn, or I love that Bible passage. They won't remember. They're shocked and they are grieving, and that's okay. They don't, so if you can write some of these things down in advance and put it in the folder with all the other things we've talked about in the weeks leading up to this, it can be real easy for them to pull this out and say, okay, this is what mom wanted, this is what dad wanted, this is, and that brings a lot of comfort to know that yes, we are doing what my loved one really wanted for their service. It can also be a good way to if you've got other groups to be involved. The easy one in my house is military, right? That sometimes families may not realize, oh, I wanted the police involved because I worked with that, or yes, I was a veteran and this was the branch of service and this is who you need, and that way we can communicate that all out. Because again, when people are grieving, they're not always thinking straight or quickly, and so to have it all written out, say, yep, Chris was in the Army, and so this is what we need to get from them, and that sort of thing. So to plan all of that out. Also up here with the form is a little brochure that gives some super basic information about funerals at Prince of Peace, some resources, how we go about including rites and rituals of other organizations, whether that's the military or the Elks or the Shriners or whoever it is, how all of that sort of works together within the context of a Christian funeral, as well as some basic connections for resources for those who are grieving. So I would invite you to have this conversation and have it more than once, and have it earlier than you think. I once had a meeting with a hospital chaplain who I knew, and she was presenting some information to all of us clergy, and she said, really, anyone with a driver's license should have some idea, because you just never know. And so you can always go back and change it if you change your mind later. Or you can be like my crazy organized husband who's got his funeral planned 3 different ways. He's got his I die in service to my country somewhere hot, sandy, and interesting funeral. He's got my I die while I'm actively serving a church, but after I'm out of the military funeral. And he's got an I die of old age.
Oh my goodness.
Like he's got 3. Like that's a little excessive. Maybe don't do that. One is good. So, but you can keep a copy of this in your folder. You can also make a copy and have it here. We will keep a copy for you in a file here at Prince of Peace. So just in case anything happens to your records, we've got something on file, so that we can come to a family member. I've found it's especially important if your family members aren't super involved in church to say, yep, these are the churchy things I wanted. Because sometimes folks don't realize what's meaningful to you and to your church family if they haven't been involved. So, do you have questions for me about planning a service or the resources we're available? Again, we've got the book. I've got a couple copies. I'll leave this here. If you want to borrow it, just somebody let me know who's got it. And we've got the forms, everybody can take those, and I am available anytime if you want to sit down with me, or if it would help to have me present when you talk with your family, because I know sometimes it's not that you don't want to talk about it, but your kids or grandkids or folks who you are going to be leaving in charge are like, oh no, I'm not ready to talk about that. Like, I don't, well, it needs to be said. It needs to be said often. So, any questions for me? All right.
Just super thank you for having all those things available for everybody.
Oh, you're welcome.
Yeah.
So this will be up here along with the other handouts here.
Okay. Hilary.
Well, my theme is very similar. Write it down, talk about it. If you do neither, your wishes may not be honored. And just about 5 minutes ago, I grabbed last week's handout from Kelly Kudorkis. I've spoken with her before, and my topic was originally going to be very similar, so I'm going to do a little flip here, actually. I'm still going to give you some resources and talk things through, but at a little different angle, so you're not getting as much of a repeat. So I'm going to kind of piggyback on the after death. So when we talk about planning, there are 3 different, I call them pillars of planning. And I am going to be passing this out as I'm talking. And
Just so you'll pass them out.
oh, that would be beautiful. Do that. The after death pillar of planning, I'm going to start there. Usually I end there, but I'm going to start there. So that is exactly what we're talking about, and I love that planning sheet. Funeral homes give them out as well. The other additional facts that are good to have as well is, who do I want contacted when I pass away? I have a 91-year-old uncle, and I'm in charge of his finances, his everything. And when I sit down with him, about once a year, I ask him, okay, because I don't know his work buddies, I know his children, but I don't know some of his old contacts. So I said, give me a list of who you'd want contacted when you die. Because now, people don't always put death notices in the paper. And so some people are very upset and offended that they hear 6 months later. So that's one other piece to write down. Who do I want called if I die? When you're talking about after death, it is absolutely about planning the funeral. And you can also, you can prepay a funeral, but you don't have to. You could still go to a funeral home or have planning papers like that and get everything organized. When you're thinking about end of life planning, it's what do you want to do with my body and have my services after I die? Do you want to donate your body to science? Do you want to donate organs? So that's another thing to think about, document, and talk to family about. In this area, Western Med does take bodies as well as U of M. Those are the closest. There's 4 universities that take them in Michigan. Some people choose to do that. You're not gonna have a whole lot of control of what they do with you. But some people choose to do that. And as well, you can document if you want to donate organs, skin, tissue, bones. You can document that too. Right now, Secretary of State, you can check that you want to donate organs. Usually, it's very well intentioned when everyone says, yes, I want to donate, but it's really circumstantial on the condition of the body and the person and whether they're able to take that, to be honest.
So that's on the driver's license?
Yes, that's one, Secretary of State, you can say, yes, I want to donate organs. It's called Gift of Life, and then that organization will work with your family after you pass to see what you want to donate. Yeah. The other thing about planning for after death, and I'm going to do lots of work today if you don't mind. About 4 years ago, Michigan's funny with cremation in particular, because it's the majority rules of your next of kin. I have 3 children, so I could tell them all my life I want cremation. That's what I want cremation. After I die, if I do not write anything down, and 2 of them say, no, I don't think so, I don't get cremated. So this form that's being passed around right now is very important because it's saying who you want to make your funeral plans, and whatever that person says goes. The form is a little funny. It's just 2 pages, but you actually have to notarize and witness it, which I find a little odd, but that's just the way they created it. Whenever you want to notarize something, just go to the bank. Go to the bank and you'll get both that notary and witness. But again, it's a very important form to consider doing, especially if your wishes are cremation. The other type of, how long do this? Okay. I'm going to go in a little, because again, most of my topic is very similar to what Kelly talked to last week. So my background is in healthcare. I used to be a social worker in nursing homes. I used to be a public guardian. And now I used to work for Area Agency on Aging. And so I've seen people through various levels of care. And so as someone is aging, all of us ideally want to age in place. We want to age at home. So some of the services and supports that are out there are underutilized, or if they're utilized too late. So I'm just going to kind of, off the top of my head, just give you some resources and thoughts if you or loved ones are needing some care. The first resource is Area Agency on Aging. Every region in the state of Michigan and the county has one. Here in Kalamazoo, it's the old county building. I just moved to Kalamazoo, so I lived in Coloma, so I was going to say St. Joseph, but the Area Agency on Aging and Milestones Center does so many things. They have an information and assistance line. You can call that line and ask, I'm kind of looking for a cancer support group. I can't afford my hearing aids. I'm really worried about my mom. She can't bathe anymore and she needs help with meals. They can connect you with the community resources, with grants. I need a ramp to the house. They know what's out there. It's like the aging 2-in-1 call, but they're specifically for aging resources in the area. So use that information assistance line through Area Agency on Aging. There can be things like, hey, I just had a surgery and for the next 8 weeks I need help with. Do you have some sort of care management or services? So know that that's there. They can help connect you to a program called Waiver, which is a Medicaid-based program, is where if you're nearing nursing home level of care and you're needing help with daily living, they can bring caregivers and supports into your own home so you can remain at home. There's another program called PACE, Program of All-Inclusive Care, and that's basically a all-inclusive adult day. So so let's say I was caring for my mom. I have to work during the day and go to the office. She would go to this PACE program during the day, maybe 3 times a week. And her doctors would come there, she'd get meals, she had activities. But the bus would bring her back and I'd take care of her at home in the evenings and weekends. So it's a collaborative, shared type of care where that person doesn't have to go into a care home. And there's all sorts of other levels that Area Agency on Aging does, as well as with just little levels of support with care management too. So just know that they're there. The other type of aging in place supports that there are out there is palliative care, and we all know about hospice. Unfortunately, hospice is too often not called soon enough. People use hospice less than a month. Hospice is amazing. It's my dad was one that he only was on hospice about a month, and he was in extreme pain before he finally said, "Yeah, call him. I'm ready." He could have had those supports earlier. And hospice is covered by your Medicare. They help you with pain management. They help you get any type of supplies and services you need into your home for that care. There's a social worker. There's a chaplain. You do not have to go out to the doctor to get a service or something. The doctor or nurse comes to you. It is so amazing. So just know to ask or consider if someone is declining and you think they may be within that 6-month window. I think just the word hospice is scary. And again, my dad did that same thing. It's just like, oh. Palliative care is a type of healthcare that is prior to hospice. This is someone who has quite a few chronic debilitating illnesses. They're home or nearly homebound, and they need help navigating this very complex care. And here in Kalamazoo, Centrica Care just took it over about a year ago. We had it at Bronson, and now Centrica Care does it. It's palliative care, at home, in the community palliative care. And you kind of can think about it as middle management healthcare. You still go to your regular doctor, but you have this whole team that comes to you in your home, usually every 2 weeks, and they can kind of help. There's a doctor that comes, a chaplain, a social worker, and they can kind of help you navigate that illness or that what you need for that. I'm literally walking backwards from death to different care because I just did a last minute flip in my mind based on what you heard last week. The other thing I want to mention is, as someone is aging, no one ever wants to think about, you and I were talking about nursing homes. That was my first job when I came out of college. I was a social worker in the nursing home. There are so many different types of care homes, and just like that newspaper said, there's so many different types of expenses and who pays what. Right. So I'm going to kind of go through the different levels of care homes and who pays for them, just for your background knowledge. So, can I continue if I should go forward or backwards? I'll continue with the backwards row. So the most intensive care is a nursing home. Nursing homes have 2 types of care. You're going to have your rehab stay. I broke my hip. I need to stay there for about a month to get some therapy. That's covered under Medicare as long as you're covered still attending therapy. The government cuts that off mighty fast. And if they cut it off too fast, there's actually a protection agency that you can call and say, wait a minute, I can't go up the steps yet, and I can't do this, and you're saying my therapy's done.
Yeah, Hilary, what is it? It used to be 180 days, now it's down to 90 days?
Oh, you know what? Oh, it's changed so much.
Changed?
Average is 21 to 30 days.
That's it?
So you technically can get up to 100 Medicare rehab days
Per year?
per diagnosis, per
episode.
Yeah, per episode. However, the government kicks people off so fast. Again, I've seen really intense diagnoses within that 30 days. So that's there, and it depends on what type of Medicare you have on, and whether you have any co-insurance on that. We'll do that separate. So as far as other types of aging homes, I'll kind of go through the list of them and who pays for whom. You have adult foster care homes. These are smaller homes out in the community. They take between 5 and 20 residents, and most often not covered by Medicaid, and they're most often just out of pocket. They range from $3,000 to $8,000 a month, and they're not always regulated, and there's the good, the bad, and the ugly. You better watch these homes real careful. There's good ones, there are good ones, but there are ones that I wouldn't put my pet mouse in. There are awful ones. So you really have to watch them. There are assisted living type of homes, and these are on the cost layer, but they're usually very high quality. My uncle is in an assisted living home right now in Allen Park, and I visited him a couple weeks ago. You go downstairs and you have it's almost like you have meals to order. It's almost like going to a restaurant 3 times a day, and there's levels of care. When he was just out of the nursing home, he needed more care, so he was a level C. Now he's back up to a level A, so they'll do things like clean his room. Sometimes he gets his meals, and it just depends on what type of care package you need. But those range between $6,000 to $12,000 a month. So most people's incomes can't afford that. There are also a type of care home called continuing care, and these again are only for folks who have quite a bit of money, because what you do is you actually buy into them, and then you have a whole continuum of care that you can bounce to as you age or need that. I walk in, I have the assisted living portion. I'm starting to get more ill. I may have like a nursing home type portion. Maybe I'm getting confused and getting dementia. There's a dementia unit, all the way to a hospice. So everyone has little different realms.
So Hilary, the examples of that here in
I want to say Friendship Village.
yeah.
Story Point's a very good example of that too. They'll do everything from independent to,
Right.
they have a dementia wing where it's locked unit, 100% taken care of.
Yep.
Heritage is another
Yes.
one.
So when you say home, you mean like a congregate setting, not a personal, like a house.
Some of them are fancy enough to have little condos.
Right, but it's
independent
not,
living.
it's not like an adult foster care that's in a neighborhood
No.
that, yeah,
No,
okay.
yeah. But and I always, it's good to know the differences of these type of care homes, because often when we have to make these decisions, it's that sudden event happened. Someone had a stroke. Someone had it's this fast decisions we have to do. Where do we go? What do we do? I don't know where to start. You start at Area Agency on Aging. You research these places. You ask questions. What does this cost? Who covers this? What insurances? How long? And the other thing you want to consider is, okay, can I afford that for 3 months? But then what in 3 months? You don't want to be hopping around. You want to go to somewhere and be stable.
So you started with adult daycare, or adult foster care as the bottom financially. Like what happens to people who don't have any money? They get overserved in a nursing home?
They sometimes they basically, because in the nursing home you have the rehab days like I mentioned, and then you have the long-term residents who are paid by the state, and you have to do an annual Medicaid application. You're only allowed to have $2,000 of cash assets. Even if you have a house, you're allowed to keep a house and a car, but you're not left anything to maintain it. I think you get a measly. You basically have to pay all of your income to the nursing home less $60. They allow you a whole $60 a month for your personal needs. So like get your hair cut and 2 pair of jeans. I mean, that's about it. You get that. Yeah, so that's again, I kind of went on spur of the moment flip on there.
But back to my my question. If you're not nursing home material, you die in your own home, like you fall and then someone finds you on a wellness call 3 weeks later, or?
There are, people have to navigate and see which care homes will work with Medicaid. There are a few of those foster care homes that will work with Medicaid, not many.
Well, the waiver pays, but that's with Medicare. So if you're old, you're okay.
No, PACE and waiver are actually Medicaid, not
Okay.
Medicare.
Yeah.
Medicaid is state of Michigan, Medicare is federal government.
So there are foster cares in this community that, the waiver pays for people to stay there.
Yes, it will supplement the care, so both the foster care and the waiver they'll both kind of combine care, not overlap, but they'll combine care to give that person care, yes. Veterans as well, there is a widower's benefit. Know that if you're a veteran, it is a painful process. It takes the government a lovely 9 months to a year. But if you're a veteran and you need care in your home, you can go to the county and there's a veterans representative there and you can fill out the forms. They will sometimes increase your income and they will sometimes give you care and supports. It just takes a while to get everything adjusted. Once you get on, you can update that. When the veteran passes away, that widower, that woman, often woman, not always, could be a man too, has that same veteran's benefits, and they don't advertise that really well, those widowers' benefits. So as that woman ages and she needs care, she can call the veterans and get that widower's benefit too, and that same thing, that income, that care. I've seen people renovate bathrooms, get ramps. Once you get the government finally turned on, they do pretty good. It just takes a while once you get that first application. Okay, I'm going to, this is actually what Kelly talked about last week, and this is about healthcare planning. And so she talked about financial planning and healthcare planning. And so I'm not going to actually cover the financial portion because I saw she did that about the different what's the difference between a will and a trust and a financial durable power of attorney. But I want to accentuate the healthcare topic a bit more. First off, you do not have to go to a lawyer to complete an advance directive. I'm handing you out the free form. I'm pretty sure she didn't give you a free form. Forgive me, but healthcare planning. Kelly talked about financial planning. What do I want to happen? My stuff, my money. We talked about after death planning. What's going to happen to my body after I die? Healthcare planning is what's going to happen to me. Who's going to care for me, my health, and my needs? Statistically, 85% of adults will need help with their care someday. So we'd like to think, oh, I don't need this. I'll always be able to make my own decisions. I'm good. I can think, well, I'll always be able to do this. You'll likely need help. And I saw that she mentioned this too. If you don't complete an advance directive and complete this form who says, this is who I trust to make decisions for me, medical decisions. If you don't, and let's say you need to be in a nursing home, you're in the hospital, you just had a significant event, you can't speak or make decisions clearly. Doctor says, I'm sorry, Hilary can't communicate, she can't understand, she is not capable of making medical decisions. Let's say I haven't done this form. What's going to happen is the social worker is going to talk to your family and say, you know, you need to go to probate court and get a guardian. You not only lose the power of who's going to step up to make your medical decisions, it's just going to be time and a pain for their family to do that. If you complete this form now, when you're well and can think about it, you have the power of saying, this is who I trust.
That's this one.
Yep. This is who I trust. And this form, you want to put at least 2 people on there. I wanna put a primary patient advocate, but if they're not able, so let's say you're in a car accident together, you're both in the ICU, you can't make decisions for each other. So then they're gonna say, oh, here's the second person we'll call and to make decisions. That form not only names a patient advocate, but it also basically outlines how much life-sustaining treatment do I want to undergo. And very, very important, on the form there are 2 questions. One is, how far generally, what's my general feeling about life supports? Yes, I want everything done to me. Try, I'd like you to try, but if it's not working and my body's shutting down, stop. And no, don't put anything on me at all. But that's just a generalized question, and it's vague for a reason, because there's 5,000 ways things can go down, and we can't say specifically. I get a little bit annoyed at the older forms that talk about, if I'm in a persistent vegetative state, okay, there's only a tiny % of people that will ever be there. That's a 0.000 something %. There are so many other situations. So you're trusting your patient advocate you put on there to look at the situation, to know you, and to make a decision based on the whole picture and the whole situation. The other question on there is, seems fairly simple. Do you want CPR? Yes? Try? No. Any past nurses or healthcare workers? Okay, describe CPR. Give me a description of it.
Notably violent. Is the
Okay,
way I
no.
put it. I mean, so I was a paramedic, so I have been the one to initiate it a number of times. I believe the American Heart Association says for an adult you must compress the chest 1.5 to 2 inches. That is sufficient to break the cartilage on all of your ribs connecting to your sternum. I will do that for about 2 minutes. Somebody else will get off, or I'll get off. Somebody else will continue to do that for the next 20, 30, 45 minutes, depending on what doctor I'm trying to talk to. In the
And
meantime,
then what happened? What's happening with the lungs? Yeah. Cool.
in the meantime, we'll go the route you want me to. So,
Oh, okay.
so either way, in the meantime, somebody else will then put it's called a bag valve mask. It's basically just a bag that you squeeze air into. It'll start with the mask on your face. As I, the medic, start going into doing more advanced care, I will then stick a tube down you or your loved one's throat. Depending on which device I use, one, it might just rest right over the glottic opening to kind of force the air in, or I can actually intubate you as they would in the hospital, where it will actually pass between the vocal cords. I will then inflate a balloon to hold it in place, and then we'll continue to use that as your airway. I'll also attempt to start an IV. If that doesn't work, then I have a needle that I will actually drill into your bone, and we will then just insert the medication directly into your bone.
You need to come to all my
Yeah.
presentations.
Yes, stop me whenever you'd like.
Stop
but-
it.
Well,
I get the idea. Yeah.
So that's basically, when we see CPR on TV, that's not what we see, is it? So what we see is you collapse, so I just gently push a couple times, you cough and you sit back up and we just continue the meeting. That's literally what the TV shows.
Yeah.
That's not reality, and we're not trying to scare you, but give you some information to make an informed choice, because CPR and a ventilator go hand in hand, as well as ICU most of the time. So CPR success rates are important to know and understand. It depends your age and health condition, and where you are some factors to consider. If I am out in the community, at the grocery store, at the church, at home, anywhere, I have about 12% chance of surviving CPR. And that is because 50% of incidences are witnessed, and there's a time factor. So that healthcare worker needs to come to you, you need to get to the hospital. Is that person doing CPR correctly? There's a lot involved. if I'm actually in the hospital, let's say I'm having a foot surgery in the hospital, there are two instances. If I'm actually on the table during surgery, CPR success rate is actually quite high, about 85%. You've got doctors and nurses right above you, they usually take care of things, if your body's not completely shutting down. But CPR in the hospital, when you literally can call a code red, we have a team of about 8-10 people come, we have a crash cart, is about 25% chance that you would survive CPR if you're right in that hospital setting. Age and health condition make a difference. My 24-year-old 6-foot son who runs 5 miles a day, myself at age 50, my mom at age 76, and grandma at 99. We all had the same health incident. We're all going to weather that much differently. CPR absolutely has its place. It saves lives in certain circumstances. So I don't want us to say it's 100% bad, but and if I think of like the nursing home residents, so if you think of very aged, very frail, chronically ill, less than 5%, it's generally less than 3% chance of surviving CPR. Scary to think about. That's a scary statistic. And if you're wondering, like, what would I be? Age and health condition make a difference. So I may be more frail medically than my mom. My mom may weather something different than I would. You actually can have these conversations with your doctor when you go for your annual wellness, or just ask them, with this, and this, what this would look like for me. And then they can't say, well, you have a 62.1%. They can't, but they can still give you some context. They can give you a little bit of context and information of what that would look like with where you are health-wise. One thing I want to stress with that healthcare form that I gave you is it's not just about the yes, try, no. You want to fill the form out, but you want to have a conversation and fill in the gray areas. And so there's 2 tools in there. There's page 5 has some conversation starters. What's quality of life? If I'm asking my family to make this big decision of whether to stop life supports, where do I draw the line in the sand of that's acceptable way of living, or heck no, don't do that to me, let me go. And so there's some questions to kind of help guide that, because it's a strange conversation to start, but very, very important to do, to talk through that and to update it.
Should you have one of those forms? Back in the day, everybody had a form in their refrigerator, so when the EMTs came, they could see what was on your form. Should you have something like that in your home, and where should it be?
Great question. So he just stepped out, but file of life. So you can go to Family Dollar, get a red folder. They pass them out at senior expos, but they give like tiny ones. So get a red folder from Family Dollar. Print on it, file of life. Put in your advance directive, a copy of it. List of medications, emergency contacts, and allergies. EMS does know when they come into your home, they do look on the fridge on it, not in it. And they'll grab that and then look at all the information they have. Oh, they're allergic to penicillin. Here's the person I call. They have all that right there. They grab that and that goes with you. So very, very good thing to do. Okay, about 10 more minutes. Is that my time?
Yeah. Yes.
Okay.
And then Lynn will take over in the last 5 minutes.
So who has completed an advance directive? An advance directive is also a durable power of attorney for healthcare that people get done for lawyers. So who's completed them? Okay. So I work at Western as an adjunct, and I'm gonna give you some homework. Those who raised your hand, I want you to look at your form this week. And I want you to look at your folks. Are these still the folks you want? And I want you to look how you outlined your medical decisions. Is that still what you want? You can update these forms at any time. And again, you can do it for free. You can get to complete this form. You can update it when family relationships change, when health change, and we're always going to take the newest form. When my dad was in hospice, he was in palliative care in hospice, and he had testicular mesothelioma, and he had 7 years. When he first was diagnosed, he looked at this and he says, try, I want chemo and radiation, and I'm going to fight this. And he did. He had chemo, radiation, surgeries, did everything. 5 years down the road, the cancer was growing, his body was shutting down. Walker, wheelchair, pain, lots of things happening. Then we sat down and had more conversation, because as a healthy person, we're filling this out, we're just thinking, well, what if I get into a car accident? What would I feel? But it comes in context when you actually have a health condition, especially a fatal one, and you know what's happening. That way the doctor and you and family can have a more robust conversation with this illness. This is what CPR or ventilation would look like, or would or wouldn't do for you. So my dad and the doctor, hospice doctors, had that conversation. He did a new form and said, no, I'm at the point where I don't want aggressive care. Don't do anything to me. And then he filled a new form out. So know that you always can change that, and you always want to open up that conversation. That 91-year-old uncle, prior to going to the assisted living, every family reunion we had every 2 years, I grabbed 2 glasses of wine, and I kind of give him a look, and he would roll his eyes at me. We would go to a little gazebo, and I'd initiate this talk with him. Okay, do you have AFib, and you were in the hospital 3 times this year? The last year you told me this, and I'd ask some of these questions. It would take him a little bit to start talking about it, but I have to make your decisions if ever needed, and so I want to know this information. So your other homework is to, if you haven't had that talk with family about what's acceptable, what's not acceptable, what's quality of life to you in the last year or 2, have that tough conversation. That conversation and knowing you lets that patient advocate make good decisions the way you would. That conversation is key, and that's often missed. Okay, I'm going to make a pretty radical flip here. So, we talked about all the different types of planning. The other type of planning, so you've got healthcare, designating a healthcare advocate, a patient advocate, a HIPAA form, which Kelly talked with you about last week. You can get that free too. You don't have to pay a lawyer for that one. I used to work for Area Agency on Aging, and so another type of healthcare planning that's very important is, does my health insurance coverage fit my needs? We talked about all those different levels of care homes and who pays what. So who here has Medicare? Who's over the age of 65 or disabled? Okay. So pass these out to anyone who has their hand raised.
You get one.
Anyone have or wanting to have Affordable Care Act type of health insurance through the government? Anyone? Okay.
No, sorry, this is for her.
Okay. So I'm passing around a little bookmark, and I had to make some copies because I was out of the real ones. This organization is called MAP, Michigan Medicare Medicaid Assistance Program. And they are amazing. They are statewide, and they are free, local, unbiased counselors that can sit down with you and help you with your Medicare. They can help you choose a drug plan. All of a sudden, middle of the year, you get really expensive medication that they say, oh, this is $2,000 a month. You're like, oh, call MAP. They can help you find a pharmaceutical assistance program. A loved one needs to go into the nursing home and you're handed a new Medicaid application. You're like, what? MAP can help you with that. They can help you with savings programs to reduce cost of drugs. For 2024, the federal government now opened up a savings program. It used to be tiered, and now it's going to be anyone below 150% of federal poverty will be able to get some reductions on their Part D prescription plans. So they opened it up a little bit. And also the government has also made, in this year, some caps on diabetes medications as well. So they're very slowly helping, but and that catastrophic coverage in the donut hole too is slowly changing too. But when you call that 800 number, you're not calling Timbuktu. It's going to look at the 269 and it's going to lead you right to Milestones, which has MAP counselors. They'll be able to sit down with you one-on-one and you can trust them. They can help you navigate any of these type of Medicare things. Right now is open enrollment, October 15th to December 7th. You want to look at your drug plan if you have original Medicare. You want to look at your Advantage plan if you have an Advantage type of Medicare. You can flip into different Advantage plans. The website, if you have an Advantage plan, the website to look at is Q1 Medicare, because they're very tough to compare. And just be very cautious because, did you get one for yourself? Okay, good. Be very cautious because there's a lot of hidden costs with Advantage plans. So I went through a lot of topics and I did literally a shift in the last 5 minutes prior to talking of topics. So questions, anything at all?
Yeah, the last one you talked about the Medicare, we have people who call us 3 times a day. and I've gotten to the point saying, I think I'm okay, and hang up.
They are salesmen and they sell their certain name brands. Don't trust them.
Yeah, we don't answer
No.
anymore.
I get frustrated. In the fall, even looking at the TV infomercials. And I get frustrated. Even the senior centers, they will let some of these scammers in and they'll have them talk. I'm like, oh, they're not trusted. They're just selling for the insurance, which has like a $10,000 out of pocket. Well, then they say, well, we have silver sneakers. Well, yeah, okay, you pay $10 a month for them to get gym, but they have to pay $10,000 out of their medical.
Earlier in your talk, when you were talking about the resources and adult day and the different models, how do you decide that someone can't be left home alone?
Ooh, I forgot a topic. Yeah, I'm glad that you. That is tough. That's a very, very tough place. There's a vast gray area of like, hey, they're safe and well, to they're struggling a little bit and they're doing okay, to this is not safe at all. And there's a lot of parameters there as far as how you decide, how you intervene, whether that person's willing to accept those interventions. So you have to trod carefully. Kind of use a little psychology a little bit with your conversations sometimes. Couple resources to think about. If you have a loved one that is actually neglectful, you can have self-neglect or someone else can neglect you, and it is a type of elder abuse. I have absolutely known lots of people who are like, I want to stay home and I'll do everything, and they are not taking care of themselves. They're not eating, they're unsafe, and you can try to intervene, try to help them in different ways, try to get services and care and supports. If they're absolutely refusing, it's unsafe. There is a elder abuse 1-800 phone call from the state of Michigan. Call that, Adult Protective Services. You call that number and you give details. The more details you give, the more chance that they will come and take that seriously. And it feels like you're like, oh no, I'm reporting on them. You could be saving their life. You really could be saving their life. So you give details. Yes, my neighbor Esther, I saw her yesterday. She walked out in the snow and she had no shoes. In the last 3 months, I've noticed her clothes are baggy. She looked like she's lost a lot of weight. Give details, and to make sure that intervention could be, because if they walk in and see that person is not caring for themselves, that's not safe at all. They will help sometimes get a guardian, get them into care. They'll do lots of different things to intervene. Also, it's been about a year since I've looked at the statistic, but probably 10 to 20% of elders will be financially abused. Financial abuse happens all the time because those over the age of 65 in the United States have over 75% of the wealth. So guess where people are going to turn to when they want money. So be very, very watchful for financial elder abuse, and you call that same number and you give details and you report it. I can't tell you how many scammers will be out there. I used to be a public guardian, so I have like dozens of examples under my hat, but one of them is I had a sweet, very confused lady who her boyfriend died, and her boyfriend's daughter, who never cared much about her at all, came and brought her some flowers one day and said, you know, I'll always be there for you and to help you with your bills, whatever you need. I just need you to sign the deed over here. Could you sign half this deed? She signed the deed. Yeah. Financial abuse. And that one, unfortunately, that one bothered me because I had to pay that woman half the house because the woman she did have dementia, but I couldn't prove it because the woman hadn't gone to the doctor, so I couldn't prove that she was incompetent to sign. And I had to give that woman half the house. And I was a public guardian. That hurt me. But I already walked to the prosecutor and asked, and he says, there's no proof, you can't do anything. Yeah. So yeah, elder, I used to have that one memorized. But yeah, Adult Protective Services through the state of Michigan. And be very detailed. Anything else?
Can these forms be copied?
Absolutely. So you do not have to have the originals. In fact, when you complete that, you want to have copies around. Now I think of my kids, so I've got 24, 21, and 18. Our generation's pretty good at filing things and keeping things organized. My kids, they still look like they've got teenager rooms, and if I give them an important piece of paper, there is no finding it. You scan it and email it to them, because guess what? They're gonna have their cell phone on them at all times, and they'll just go, whoop, whoop, here it is. So that's a really, and then you also give a copy to your doctor's office. So the doctor's office is gonna have it within the whole healthcare system. Anything else?
I just want to thank you, Hilary. It's been very, very appreciated.
No, very good.
As usual, so thank you.